Hey guys, in this video I'm going to show you a common upper limb stroke pattern which is going to be focusing on your wrist, your elbow and your shoulder. I'm going to show you some stretching exercises as well as strengthening exercises for all of this. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. So before we get started, I want you to focus on watching this video in the top right hand corner. This exercise video is going to be showing you how to gently stretch your wrist and your fingers out before you begin any of these exercises in this video. And also for a lot of stroke survivors, I understand that finger movement is a very important thing for you that you want to achieve, but do not neglect your elbow and your shoulder. So that's what this video is going to be about. I'm going to show you shoulder, elbow and wrist exercises, and I want you to focus all of them equally. So for the wrist, the common pattern is going to be like this, which is whereby your wrist is flexed and your fingers are also flexed, and your thumb is probably going to be inside the joint, inside the fingers and the palm here. So what you want to do for your wrist is actually you want to extend the wrist. You want to be able to open up the fingers and also open up the thumb. So these are the exercises I'm going to show you for the wrist. For your wrist, you want to put it over the edge of the table here, okay, and then just slowly pry out the thumb, okay, slowly pry out the thumb, and you want to do a hand shaking movement. So you want to grab your hand and grab your thumb, okay, in this position, just slowly inch your fingers, creep your fingers into the tight fingers here, and just slowly grab and extend the fingers like this, okay, keeping the thumb out. Okay, once you are able to a little bit more open position like this, once you get into a little bit more open position like this, then come back to the table here and place your fingers over the table here. Now that you're on the table, if your fingers is curling up like this is fine, okay, just stretch out one by one, just try to straighten it and put it onto the table here, okay. So just try to keep it as close as you can towards the table surface. And in this position, I just want you to push down your palm and your fingers into the table, okay? You can also activate a bit of your triceps here, but main thing I want to focus on is look at your fingers and just push down, okay? And just relax, okay? Just keep doing this position for about 10 to 15 minutes. For each of these joints, you want to do for about 10 to 15 minutes. Don't rush through any of these exercises here, okay? Take your time and do it slowly. Okay, now what we are going to do is we are going to lift up one of these fingers, okay, just lift up gently, okay. As you are lifting up, before putting it down, just hold it there for a while, okay. So I don't expect you to be able to hold it there for about 10 seconds, no. Even if it's just for half a second, it's actually going to be very good for you. So just lift up and hold for about 0.5 seconds and bring it down, okay. So what you're doing is you're using a stronger hand to help you to lift up the fingers while using your weaker hand to maintain as much as you can before bringing it back down. So as with all of these exercises, be patient with yourself. I know it's very frustrating, but calm yourself down and just do it slowly, okay? Believe that you can actually move it and just do it slowly every single day. Okay, lift up and try to hold for 0.5 seconds and then bring it down slowly. If you find value from this video, do consider liking and subscribing to the channel for more videos like this. So for your elbow joint, what is going to happen is it's going to be flexed up like this, and also it's going to be turned inwards. This is a pronated position for your forearm. So what you want to do is you want to extend the elbow. Okay, you want to extend it as much as you can, activating your triceps. And also you want to turn your forearm outwards. So you want to turn out in this position. This is called a supinated position. These are the two movements that's important for your elbow after a stroke. Moving to the forearm and elbow, I want you to put your hand resting on a tabletop like this in an upright position, meaning your thumb is facing upwards, okay? So in this position, I just want you to massage your forearm, okay? Massage all the way to the biceps, do it very gently. If there's pain, then don't push it too much, okay? Just do it gently. This is just to get you to kind of like wake up this side of your body and also get your brain to feel all these sensations on this affected arm. Okay, do it for about 2 to 3 minutes gently. Okay, we're not expecting miracles with the massage, just get you to get a bit of warm up in the joint here. Okay, once you've done your massage for about 2 to 3 minutes in an upright position like this, what I want you to do is just grab the front of your wrist and open up your forearm. Okay, just open up and really stretch it out. Okay, really stretch it out like this. Okay, and once you let it go, I know some of you guys, the hand will just come back in. Okay, if this is what's happening to you, then I want you to slowly control the hand coming back in like this. So instead of springing it back like this, in this position, just control using your muscles to really slowly bring into this position. Okay, control it into this position. That means you're actively trying to supinate your hand, but by slowing it down, you are doing it in a lengthening position. So it is actually just a strengthening exercise. Okay, so come into a supinated position like this, and once you let go, just come back slowly. Just slowly let it inch into a pronated position, which is your standard resting position if your arm is tight, right? Okay, so massage a little bit and then do the stretching. Okay, hold it for about 30 seconds, 10 to 30 seconds. But the main thing I want you to focus on is the coming back in slowly. Coming back in slowly. Really control your forearm. Okay, then the next thing I want to focus on is actually a bit of your triceps and your biceps. We want to get your wrist into a more extended position. Okay, so just grab the front part of your wrist here, okay, and just slowly stretch it out like this. Okay, as you're doing this, what I want you to focus on is your tricep muscles trying to straighten your arm like this. So it doesn't have to go into a full straightening position. As long as you start to activate a little bit of your triceps, actually it's a good exercise already. So just get it as straight as you can. And same thing, once in this position and as you let go, the natural tendency will be for your arm to spring back in like this, okay? But what you're going to do is as you let go, you're going to activate your triceps, okay, and really hold it there and slowly let it come back in. Okay, really fighting the urge for it to come back in. You're just going to use your tricep muscles to really maintain the extension. Okay, try doing this for about 30 repetitions and you'll definitely feel tired after that. So both for your wrist and your elbow, I want you to really take your time and do these exercises. Okay, 10 to 15 minutes per joint. Do it very slowly. Be gentle with yourself. Be patient with yourself. Okay, just hold it into extension, activate your tricep muscles here, hold it there, and once you let go, slowly let it creep back in like this. Okay, that's the main aim of this exercise, to really slowly bring it back in instead of normally springing back in like this. Stretch it out, activate triceps, really straighten the arm, and let go and slowly bring it back in like this. Okay, so for the common pattern for your shoulder, what's going to happen is that your scapula, that means your shoulder blade, is going to be very rounded forward. Okay, your shoulder is going to be rounded forward. This is what we call the scapular protraction. And for your shoulder, what's going to happen is it's going to be in a more internally rotated position, and it is really going to be stuck to your body. This is called the adduction. So there's going to be internal rotation, adduction, as well as protraction of your shoulder blades. Okay, so this is what we want to reverse. We want to make it externally rotated. We want to make it a little bit more abducted and also sitting more upright in a more retracted position for your scapula. So first thing, I want you to start off with just some gentle massage over the shoulder areas here. Okay, same like your elbow, take your time. The main point of this is not to work miracles, it's just for your brain to wake up and actually kind of feel this area of the affected side of your body. Okay, so go up to all the way to your upper traps area, a little bit of the back of the shoulder as well, and also just the shoulder joint itself. So about 2 to 3 minutes, just gently massage. If this is going to be very painful, then don't press so hard. Okay, just be gentle with yourself and be patient when doing this. So once your massage is over, what I want you to first focus on is just sitting up straight like this. And for your shoulder, I want you to imagine both your shoulder blades, you're going to bring it back close towards the center part of your spine, okay? So if you're going to be more protracted forward, sit up straight a little bit and just squeeze as much as you can your shoulder blades towards the back. Okay, imagine in the center of your spine there's a ball. Both your shoulder blades are trying to squeeze this ball together. Okay, so just squeeze and hold for as long as you can, 5 to 10 seconds, and just relax. Okay, so most of you, your hand is going to be like this. Okay, in this position, just try to squeeze. Okay, you don't have to look so perfect like how I'm doing. Okay, as long as you just activate and feel your shoulder blade moving, that's actually good enough. Okay, so just squeeze that ball at the center of your spine, hold it for about 1 to 5 to 10 seconds as much as you can, and relax. Okay, so that's the first exercise, is your shoulder retraction, reversing the protraction. So we go into retraction. So as you're doing the shoulder exercise, I also want you to be very mindful. If you have a stroke, most of the time, if your hand is going to be starting off in a flaccid position, there's going to be a bit of a gap in your shoulder joint here. Okay, so just come to the bony area and feel for how much this gap is for your shoulder joint. If it's more than one finger, then I want you to be really very careful with the next few sets of exercises because it may cause you some pain and even lead to injury. So be careful, listen to your body. If it's going to be very painful, then stop doing the exercises. Maybe it's not right for you at this point of time for the exercises. Okay? So for the next exercise, I want you to grab an umbrella if you have. Okay, this is a very good example because this part of the umbrella is very nice for you to grab the handle. So help your weaker hand, okay, your weaker arm, just open up your wrist and position it nicely into this. You don't have to grab it very nicely. You don't have to go into a close grip like this. Just holding it like this, okay, in this position. Keep your elbow towards your body. Okay, don't open it up, don't go forward, just keep it towards your body using your stronger hand. Okay, using your stronger hand, grab the other side of the umbrella and you just want to open it up like this. Okay, I don't expect you to be able to go all the way like this. Okay, just a little bit of external rotation is also good enough. Okay, so just go into this position. Okay, as you're doing this, a common mistake will be as you're pushing, your shoulder comes out like this. Not yet. Okay, keep your elbow close, then only we can actually isolate the external rotation for your shoulder. Hold it there for a few seconds and come back in slowly. Okay, so the coming back in, don't let your hand spring in this way. Slowly control it coming back in this way. Okay, so grab the handle of the umbrella, slowly externally rotate your shoulder and just come back in slowly like this. Do this for about 30 repetitions, okay? Holding it about 1 to 5 seconds at the end of the range. Okay, slowly just doing this like this. Okay, so now we want to do a abduction movement. So opening up your shoulder this way. So a lot of times your shoulder is going to be very weak that you cannot even actively activate your shoulder to go up this position. So I want you to grab your hand, open it up and just put it on the table like this, forearm resting on the table like this. Okay, now in this position, because your elbow is on the table, your shoulder is going to open up a little bit. For most of you guys, when you're starting out, this is the position that I want you to maintain. This angle is the abduction angle. Okay, if you're a little bit more advanced and you feel like there's a little bit more space for you to move, I want you to shift your elbow further out. Okay, this is just going to make your open up the angle, the abduction angle, and really feel that stretch for your shoulder joint. Okay, so if you're able to do a little bit more and more, then I just want you to shift your elbow outwards this way and really focus on bringing your armpit towards the ground or towards the table. Okay, so just hold it for a while. Once again, for this exercise, if your shoulder there is a little bit of a subluxation, meaning more than one finger, be very careful when doing this exercise. And also, as a standard precaution, this exercise is quite easy for you to injure your shoulder, so be very careful when doing this exercise. Okay, so come back in. Okay, and just use your stronger hand, shift your shoulder out, your elbow out this way, and just try to bend down like this just to open up the shoulder angle. So another exercise for this stretching for the abduction, what you can do is if you're able to extend your elbow outwards this way, I want you to just place it down this way, and in this position, either you shift your chair in this position or you shift your hand. That means you try to reach across as much as you can towards the end of the table. You can put a towel on the palm here so there's less friction for you to slide. So just sliding down this way, this will also help you to open up the angle for your abduction. Okay, so imagine there's a towel here and you're just sliding your hand all the way towards the end of the table. This is a little bit more advanced. I don't expect many of you to be able to do this. So just focus on your elbow being here and just opening up the angle as I just showed you earlier. Just focus on this. Hold it for about 30 seconds to a minute. Just feel that stretch and do it slowly and gently. So you've come to the end of the video. If you enjoyed these exercises, do consider watching these two videos that's going to be focused on your lower limbs. Thank you and I'll see you in the next video.